I'm Elizabeth David. I'm a general thoracic surgeon at the University of Colorado. I practice at the Anschutz Medical Campus. The most common cases I do in my practice are lung resections. Recently, within the last 2 years, there have been several important international clinical trials that have shown that doing a smaller lung resection or a segmentectomy is equivalent to doing a lobectomy for small cancers. This is really important for patients because it means they get the same cancer benefit from the operation, but with a smaller lung resection, which means decreased pulmonary complications after surgery, better quality of life, and an easier return to their baseline functional status, which is really important when we're treating a lung cancer. CBRA is incredibly helpful at determining the precise segmental location of a tumor. And so I am able to model the anticipated lung resection very precisely. I think when I plan an operation using CBRA 3D, I probably save about 30 to 45 minutes in the operating room, which is really significant. It minimizes the anesthesia time for the patient. As the surgeon, it may enable me to eventually get to the point where I can do an additional case in a day within my block time. As I have been using CBRA, I've really started to use it as a patient education tool. And it's extremely helpful for me to be able to show patients what their operation will be, how much lung tissue I'm planning to remove, and how much lung tissue they will have remaining in place. Miss Riley is a young woman who was having some shortness of breath and exercise intolerance. So in the workup of that, she had a CAT scan of her chest, which showed a really small nodule in the right lower lobe.
I started finding that it was really hard for me to breathe, and I was doing a lot of wheezing, which is not really normal for me, being as active as I was. It was really scary. It kind of freaked me out, and then having to go through that process of telling my friends and my family that I have lung cancer, it's really hard.
I really wanted to find a way to resect this tumor that was very central in the lower lobe without doing a lobectomy for her. She's really young, very active, has an active job, and I really wanted to minimize the impact to her quality of life.
Dr. David showed me the 3D model, and she went over exactly what her approach was going to be, what segments we were looking at removing, the possibility that if she wasn't able to get clean margins, she would take the entire lobe. But she said with the way that it was placed and what she could see in the model, she was hopeful that it would just be the 2 segments that she was going to take. It made me feel really calm going into the surgery.
CBRA 3D was very helpful for planning her operation. We were able to plan that we needed to remove 2 segments to ensure an adequate margin, and that is what we were able to do in the operating room. Based on her CAT scan alone, I would have planned a basilar segmentectomy, so I would have removed segments 7 through 10, which is about double what I removed. So the CBRA 3D model was extremely helpful in allowing me to be more precise with her operation.
My family wanted me to get second and third opinions and see other surgeons to make sure that this was the best course of action. But after meeting with Dr. David and talking to her and getting to hear how she wanted to do this procedure, it really solidified everything in my mind that this was the right path for me. One of the things that really proved how well the surgery went is how quickly I recovered. I hit the ground running.
It's incredibly easy to use. I think the user interface is by far the best available. And it's something that now that I am using it, I always want to have access to. It is an absolute game changer.